Hello, everyone. Myself, Adeela Khalid, working as a clinical psychologist for the last 10 years. First of all, I would like to thank the organizers of the 73rd Indian Association of Occupational Health for inviting me. The topic of my presentation is mindfulness-based interventions for employee mental health. Let me walk you through the presentation overview. The first point I want to make is about mindfulness, its benefits, and how it can be applied in the workplace. I will present a summary of a qualitative review on mindfulness-based interventions at work, followed by conclusions and recommendations based on this work. For most of us, keeping our mind still or calm for more than a few seconds is quite challenging. More than half of our activities each day are performed on autopilot mode. So how can we be more calmer, more centered, and less absent-minded? In recent years, psychologists and physicians have turned to a practice called mindfulness with promising results. Mindfulness is the basic human ability to be fully present, aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's going on around us. A more formal definition of mindfulness is the process of paying attention to what is happening in the moment without judgment or evaluation, and without assigning meaning to them. Mindful awareness has three key features. Purpose mindfulness involves intentionally and purposefully directing your attention rather than letting it wander. Presence mindfulness involves being fully engaged with and attentive to the present moment. Thoughts about the past and future that arise are recognized simply as thoughts occurring in the present. Acceptance mindfulness involves being non-judgmental toward whatever arises in the moment. This means that sensations, thoughts, and emotions are not judged as good or bad, pleasant or unpleasant, they are simply experienced as it is, without any judgment. Benefits of mindfulness. There is ample evidence of positive effects of mindfulness on physical health. Physiological benefits. According to the American Psychological Association, some empirically supported benefits of mindfulness include the following: enhanced immune system functioning, increased brain density and neural integration in areas responsible for positive emotions, self-regulation, and long-term planning, lowered blood pressure, lowered levels of blood cortisol, a major stress hormone, greater resistance to stress-related illnesses such as heart disease. Psychological benefits of mindfulness. There is clear link in reduction of mental, psychological, and psychiatric conditions by employing mindfulness and mindfulness-based practices. Mental health benefits include increased awareness of one's mind, significantly reduced stress, anxiety, and negative emotions, increased control over ruminative thinking, a major cause and symptom of depression and anxiety, increased mental flexibility and focus, more working memory, decreased distracting thoughts, decreased emotional reactivity, increased capacity for intentional, responsive behaviors, increased empathy, compassion, and conscientiousness of others' emotions. An important application of mindfulness in recent era is at workplace. Stress in the workplace is one of the most prevalent and persistent issues that affect workers and is linked to employee absenteeism, diminished productivity, staff turnover, medical care expenses, short and long-term disability, accidents, and legal costs. Organizations are increasingly concerned with the resilience and well-being of employees, in part because of a growing awareness of the costs of absenteeism, presenteeism, and staff turnover associated with stress and mental health problems. Mindfulness trainings are also being offered in workplace environments in order to improve health and productivity. Diverse organizations such as Google, Aetna, Intel, the Seattle Seahawks, and General Mills provide mindfulness training to their employees. From the beginning, the applications of mindfulness in the workplace and in organizations were closely linked to stress reduction programs, example MBSR. A systematic review was performed in accordance with the preferred reporting items for systematic reviews and meta-analyses. Researches conducted on mindfulness and mental health in an organizational context were systematically reviewed. The eligibility criteria for screening the studies was based on PICO, population, intervention, comparison, and outcome. Although the search of electronic databases yielded 414 studies, 19 studies met the eligibility criteria and were included in this study. Qualitative review helped to categorize mindfulness-based training according to 3 key themes: mode of training, type of training and outcome. Let's have a look on all these one by one. Mode of training was categorized in 3 clusters: individual training, group-based training and internet-based training/intervention. The mode of delivering these training or interventions ranged from written content to digital games. Mindfulness-based training was delivered on individual level through lectures, prepared information, and digital games. Groups of employees were trained on mindfulness-based intervention through lectures, courses, workshops, and guided practice. Internet-based training used guided practice and digital games. The type of mindfulness-based trainings used in the researches was also varied and included digital, short-term, long-term and combination of different trainings. Digital trainings included digital games, mindfulness apps, block, hexapuzzle. Short-term mindfulness training mainly focused on 8 minutes breathing exercises, body scan, compassion meditation, loving-kindness meditation, yoga, mindful movement. The long-term mindfulness training included MBSR, internet-based training sessions, ranging from 6 to 11 sessions. Psychoeducation and mindfulness, CBT, and mindfulness were used combinedly in some of the research. The positive outcome of mindfulness-based training reported in included studies ranged from reduce mind wandering, enhance cognitive functioning, enhance resilience, leadership, positive attitude, reduce stress, enhance psychological flexibility, reduce presenteeism, and enhanced organizational skills. Commonly used mindfulness training techniques used in the studies included contact points, notice 5 things, focused standing, focused walking, focused breathing, body scan and stop exercise. I would like to conclude based on the review that promoting and identifying mindfulness-based interventions and strategies could not only help enhance employees' overall state of well-being but also boost their performance level, thereby creating a positive, healthier work culture. However, it is strongly recommended that sustained personal practice of mindfulness should be encouraged. For teams allocated time in working days to practice mindfulness should be considered. Consider how mindfulness is labeled and an adaptation of this framing according to the organizational context. Additionally, course content needs to be carefully considered, adapted to the organizational context, and delivered authentically by trained individuals who truly embody mindfulness and lead by example. Thank you.